Hello, everyone. Welcome to the Areté's Our Way Forward podcast. For this edition, we will focus on the health system. In three parts, we hope to present the six building blocks of our health system in the eyes of health professionals. For the first episode, we have invited four volunteers to the doctors to the Barrios Program of the Department of Health. Doctors Jeff Cruz, Rap Abacan, Bel Santos, and Amy Kapinpuyan. Welcome, guys. How are you?
Feeling good.
We're good.
Good. Jeff, could you describe
Enough.
journey so far in the last what? How many months?
I've been in Busuanga for the past 2 months and a half. So far, well, we didn't expect to be thrown here into a into a global pandemic. So it's been fun, but it's also been very difficult.
Difficult in what sense? Is Busuanga
Um,
really a populated area?
well, Busuanga is an island municipality consisting of 14 barangays. Three of them are island barangays, and we have a 25,000 population. Currently, we're only two doctors in this municipality, so that's handling a lot.
Only two for the entire island.
Yeah.
So, how are you able to provide the services? I mean, even before the pandemic, would that be sufficient to provide the basic services in the island?
Well, what the previous doctor did here, because I can speak for him before the pandemic started, because I got here only late February. So initially, he was able to provide the services with the help of the different rural health workers as well. So that's the barangay health workers, the midwives, and then the nurses who are deployed from DOH. So some of the functions of a doctor are actually being handed down to the levels of the midwives and the nurses as well. So I think that's how they were able to cope.
Okay. Amy, how would you describe the complement of people in your area?
Well, dito, I am the second doctor. Parang nagkataon na naabutan ko yung outgoing na MHO or Municipal Health Officer. So far, we are pretty strict din kasi may checkpoint, may health center, there's may barangay health stations pa that each of us have to visit. It's not enough, and dati pa lang before the pandemic, kulang na lang yung tao. And now, with the extra burden of the pandemic, lalo pang kumulang. It's been pretty difficult.
How are you managing that?
Well, yung current plan namin is to train the barangay health workers uh, to take our place essentially pag ubos na kami. Yeah, it's not ideal, but yun yung current na plano namin.
Well, that's an extra challenge, I suppose.
Mm-mm.
How about your rap? How is it up there in the mountains?
Hi, Gilacos. I'm Rap, Dr. Trabario Tutiboli. We're a first-class municipality consisting of 100,000 population, and there are two government doctors working here. And on top of that, we have other health workers, about 68 deployed nurses and midwives. So it's still spread thin in spite of the larger number compared to the other municipalities, just because the land area is quite large. Tiboli has a land area of about 800 square kilometers versus NCR's 600 square kilometers. And then we're only two doctors here, so it's a lot of ground to cover geographically. and it becomes difficult to coordinate across our health workers because of difficulties in accessing data signal or cellular signal. So you'd need to use other forms of communication like using radio, as in like walkies. Um, so a lot of the, similar to the other municipalities, the responsibilities of the doctor are spread out across different health workers. It can't just be the work of doctors, so it really needs to be a team effort across everyone in the health system. Um, but already before COVID, it was already quite difficult to achieve better health outcomes because the area really is just so huge, and communication still is difficult. Now with the pandemic, it's even more difficult because of the added challenge of continuously conducting surveillance for any episodes of severe acute respiratory infection. Uh, Ayun, but we're trying our best. We're trying to manage them.
Okay. Bell, in your case, do you also have that? Do you also feel that shortage of manpower? Well, see, that's part of it shows already the difficulty experienced by the health workers in the area, no, where communication and linkages can be compromised, especially during times of emergency. Okay, let's see. Knowing that you already are short-handed, knowing that um, help is not gonna come any sooner. Okay, aside from retooling some of your barangay health workers, what else could or it would be crucial in terms of providing first your basic needs and then your preparation for this pandemic. But before that, maybe you should also answer, has COVID reached your area? Okay, let's start with Jeff.
Okay, so far we've had zero confirmed cases of COVID. We have 14 suspected cases, but all of the or most of them who had moderate to severe symptoms tested negative. Um, with regard to in terms of preparation, what we actually need here right now, in addition to the manpower, is probably the actual supplies. So we actually can't activate our barangay and municipal isolation units because none of us have any full PPEs. The last full set of PPEs we have are amounting to five, and that's the exact number of people needed to conduct one patient to the hospital to be tested. So we actually can't operate any barangay or municipal isolation unit because that would put our health workers at risk. So yeah, that's one pretty big difficulty, especially because of the ECQ. Travel is very restricted. So those supplies can't be delivered here easily.
Okay. How about you, Amy?
Same with Jeff. We're really low on supplies. And aside from that, we're very low on morale na rin. Kasi we've been hiring BHWs to staff the checkpoint and do other stuff as well. Pero yung sweldo nila comes from the barangay. And the barangay has very limited funds to pay them. That's my biggest problem right now, actually. For instance, yung BHWs namin, they get paid as little as, well, zero, as in purely voluntary work lang sila, to 500. Siguro 500 na yung pinakamataas na sweldo sa kanila. So, it's, aside from supplies, we do need cash, money, or even political will, if I can say so, to push to give our health workers a higher compensation. in proportion to the risk that they're taking for COVID. Oh, I forgot to say, wala pa kaming COVID cases dito sa province. In Higakit, we only have one COVID suspect.
How do you intend to keep it that way? Or is that even possible?
To keep it at zero,
Yeah.
it's hard to say kasi we haven't actually been doing a lot of testing. So we don't really know if talagang zero cases kami, ganon. So if it were up to me, I would really try to ramp up testing in the province. I mean, that effort's already underway, but it could be a bit faster.
Okay. Oh, Belle, you're back. How about in your area, Belle? How is it now in terms of one, basic services, two, preparation for COVID?
So for basic services, doc, very limited since we depend a lot sa Calbayog, and then very limited supplies. And then now, um, ayun. So, but we're trying to keep the services back. So meron kami yung fever clinic, and then if ever there's really a need for referral, we refer to Calbayog, right? So, ayun.
How far is
Oh,
Calbayog
we also
from your...
have the bloodletting the other.
Oh, okay. But how far is Calbayog from your area?
It's an hour and a half boat ride.
Boat ride. Okay. Wow, an hour and a half. That's quite far, no? How about your preparation for ano? How well or how prepared are you based on your assessment um for COVID, for the pandemic?
We are not prepared. The past few months, I've been like getting the supplies and then setting up our COVID like a center, but um capacity wise, very very disproportionate with what is expected na number po ng ma-affect. So yan. Also, there's really a problem with the referral system and also our distance from the tertiary hospital, which is EVRMC, and that's like 4 or 5 hours away. So there's really a problem there.
Mhm. Okay. Aren't this preparation or even the basic services in the referral system wouldn't or shouldn't have they been in place already even COVID or non-COVID?
Before COVID, there is a referral system, the Calbayog. However, for COVID referral hospital, the one assigned is EVRMC. So that's the one in Tacloban. So yun po yung inaayos namin. I'm also having problems with getting the commitment of the province. Yeah. Yun.
Okay.
So I don't know. There's difference in our priorities right now. Even if I keep on showing the data that this is what's gonna happen in the pandemic and these are the things that we have to prepare somehow, di pa rin nag-meet po yung goals namin. So, yeah.
Okay. Rap, how do you foresee now, given all of these problems and how you're trying to manage, how would you foresee the adjustments of the health system? In other words, if you will have your way, how should health workers, the issues of health workers and service delivery be addressed by the health system in your locality, Rap?
Okay, so for a little background then, in our municipality, we've already created a duty schedule for nurses that are going to do duties in the municipal isolation units or the Ligtas COVID centers. And to make up for the loss of the nurses from the barangays who are going to be shifted into the centers, they need to do some decking, so they need to cover for each other's areas. But we can only do that to a certain extent before we can start really seeing some compromise for primary healthcare services that are very essential, such as hypertension or diabetes management, some antenatal care, prenatal checkups, family planning services, vaccinations. So it really has been prioritizing COVID at the cost of other very important services as well. Um, of course, the natural response is to re- add, put greater emphasis in our investment into health, being able to compensate our workers so that they don't need to find work abroad, to incentivize working back into the provinces. Um, you can see that most of our health workers are deployed or nationally hired. And that's a problem because, um, well, it's an indication also of the LGU's low investments in health, their low ability also to spend for the personal salaries also because of there's a PS cap, so you're unable to spend a certain amount of your budget on salaries. So that's the limit on the number of health workers that you can hire. Um, it really has been a symptom of public health taking the backseat for decades or even ever since the founding of the country. Um, so, sorry, what was the question again?
What would be the ideal um what would be the ideal, or in other words, how would you be able to prepare your municipality better next? I mean, should there be another pandemic?
The pandemic. Hmm. Well, this scenario has never been brought up in any conversation. That's why it caught everyone by surprise. No one's ever done any scenario building exercises. No one's ever thought of what we're gonna do once we start seeing doctors and nurses falling into quarantine, such that we are going to have to start recruiting doctors from the private sector naman into the public health sphere. Um, it really is so difficult because um, there's an added difficulty with the need to quarantine. When you need to isolate so many people after they do duties, you really start running thin. Like even now, as a doctor to the community here, I'm already being texted by the hospital or COVID referral center if I can do duties there already, because they're already running out of doctors in South Cotabato because so many of them are already under quarantine after doing duties there. Um, that's a tough one because you'd have to go back to the country's capacity to produce health workers, and then the country's ability also to retain all of our health workers, because the Philippines is a big producer of medical professionals or doctors and nurses, but perhaps the retention also is quite low, and the concentration really is in city centers. Um, Not so much out here in the woods. So
Okay.
yeah, going back to the education system is a really big role. Perhaps also to incentivize young doctors or nurses to consider community medicine or community practice as a real option
Okay.
as much as resident training.
Thank you, Raf. Yeah, do you think there's any hope for, let's say, Buswanga to have more volunteers, doctors?
When we talk about hope, but the reality of the situation is we're in a inaccessible island, um, and travel of people is prohibited right now due to the enhanced community quarantine, and also there's a level of the provincial who's also not allowing intermunicipal travel. So increasing the number of HRH or human resources for health here isn't such a big option right now. So I think the better way to adapt to this situation is considering most of the health practitioners as actual doctors, or devolving some of the responsibilities that we have into the midwives or the nurses in order to accommodate all the needed health services to be provided to the people of Busuanga. Uh, so yeah, there's always room for hope.
All right. Amy, what would be, or in your case, in your area, what could be a better alternative or in other words, what will it take to prepare your municipality, not just for a pandemic, but to be able to meet the basic services that the people will need?
That's a hard one. It's gonna take a lot of patience and a lot of teamwork kasi yung situation right now is not everyone realizes the magnitude of the problem. Not everyone realizes that this is gonna last potentially a year or more. And we have to think long term. And not everyone in my government understands that fully. So it's gonna take a lot of teamwork and trust, a lot of trust in us doctors. And on the part naman of the constituents in our area, it's gonna take a lot of trust on their part, trust in the government that we're doing the right thing.
So, okay. Unfortunately, we don't have much time. Too bad. The discussions are just beginning. Hopefully, the next time we get to talk to you guys, things are much, much better. Not only in terms of people. All right. Anyway, so it seems the shortage for our human resource for health is really apparent, more so with this pandemic. Um, there is a need to boost the manpower, especially in the far-flung areas, more so your geographically isolated and disadvantaged areas. How to recruit more people, how to make sure that local government will put more significant or more emphasis on boosting the health system, then it needs a lot of people working together, different sectors, different stakeholders coming together, you know, to address this particular need. So thank you everyone for joining us. Perhaps the question I'd like to leave with you is, how do you think your local government, for the audience out there, how do you think your local government can improve the service delivery in your area, particularly in not just in hiring more health workers, but also in providing for the support services and the supplies that are necessary to deliver the basic services. All right. So this has been Sio Marquez, your host, and we hope to see you in the next episode of this particular podcast on the health system. Thank you and have a pleasant day.